Hello, bonjour, Kwe. Apologies for the slightly delayed start tonight. Thank you all for being here on one of the final meetings for this term of the Board of Health. I'd like to begin the meeting by honoring the Algonquin Anishinaabe Nation, the land and the people. Anishinaabe Nation and is the gathering place for many Indigenous peoples. On behalf of the Board of Health and everyone at Ottawa Public Health, I'd like to honor the land and the peoples of the Algonquin Anishinaabe Nation, whose ancestors have lived on this territory for millennia and whose culture and presence have nurtured and continue to nurture this land. I'd like to extend the honor to all First Nations, Inuit and Métis people, their elders, their ancestors, and for their valuable past and present contributions of this land. With that, we do have a few reminders for participants. Anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. For those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put us on hold so we don't get that beep. Please avoid using speakerphone when speaking. Speak directly into your device's microphone or your telephone receiver. And for those participating in person, hello everyone. We'll keep our laptops or mobile devices on mute, and we'll use the tabletop microphones when speaking. So with that, we will start with our declarations of office, and I'll invite Caitlin Salter-McDonald to administer our council members' declaration of office. Caitlin.
Thank you very much. My name is Caitlin Salter-McDonald, Manager of Council and Committee Services and Deputy Clerk, and I'm very pleased to be here this evening on behalf of the City Clerk to administer the oaths of office, declarations of office for the new appointees to the Ottawa Board of Health. This is, I believe, the first hybrid declaration of office we've done, certainly at the Board of Health and perhaps at City Council. So if you'll bear with me, we will get through this. So I will read each portion of the declaration and ask each of the new councillor members of the Board of Health to repeat after me in unison. So if you're in the room, you would unmute your microphones. If you are appearing with us virtually, you would unmute yourself on Zoom. We will alternate between English and French. And at the end, you will all sign your declarations, and those will remain on file and for posterity. So we'll begin. Repeat after me. I, having been appointed as a member of the Board of Health for the City of Ottawa Health Unit.
I, Catherine Kidd, having been appointed as a member of the Board of Health for the City of Ottawa Unit.
Do solemnly promise and declare.
Do solemnly promise and declare.
Que je me quitterai fidèlement et impartialement de mes fonctions.
Que je me quitterai fidèlement et impartialement de mes fonctions.
Au mieux de mes connaissances et de mes compétences.
Au mieux de mes connaissances et de mes compétences.
I have not received and will not receive any payment, reward, or promise thereof.
I have not received or will not receive any payment, reward, or promise thereof.
For the exercise of this appointment in a biased, corrupt, or in any other improper manner.
For the exercise of this appointment in a biased, or in any other improper manner.
Que je déclare tout intérêt pécuniaire, direct ou indirect.
Que je déclare pécuniaire, direct ou indirect.
Conformément à la loi sur les conflits d'intérêts municipaux.
Conformément à la loi sur les conflits d'intérêts municipaux.
And I make this solemn promise and declaration conscientiously, believing it to be true.
And I make this solemn declaration conscientiously, believing it to be true.
And knowing that it is of the same force and effect as if made under oath.
And knowing that it is of the same force and effect as made under oath.
Thank you, Caitlin, and a warm welcome to our new council members to the Board of Health. With that, I'll ask Diane, our board secretary, to conduct the roll call, please.
Member Banham?
Present.
Member Carr? Member Carr? Okay. Vice Chair DiGiovanni?
Present.
Member Dudas?
Ici.
Member Gower?
Here.
Member Kavanaugh? Member King?
Here.
Member Kitts?
Here.
Member Lakin?
Présent.
Member Pinel?
Présent.
And Member Tilley?
Present.
You have quorum, Madam Vice Chair.
Thank you. So we believe that Member Carr is online, so might be having some issues with muting.
Yes, I am online. Sorry.
Excellent. Thank you and welcome. Okay, so for procedures, we will go through our procedures for our Zoom meeting to follow our procedural guidelines, and they are being implemented to promote orderly proceedings at this meeting. So as a reminder, attendance: should members participating via Zoom need to leave the meeting, they should advise verbally that they're doing so before clicking on leave meeting from the Zoom platform or ending their call of participating by phone. Speaking order and the process for speaking: the chair will provide each member with the opportunity to ask questions or comment, and members will be called on to speak in the order or the reverse order as set out in the board secretary's voting list, and the usual 5-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. And for voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Points of order, privilege, and challenge: procedural interjections should be kept to a minimum to ensure that the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. And as a recess, should we have technical difficulties or other unforeseen matters requiring a recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line, and the board secretary will mute all participants in such an instance. Okay, our rules of order for Zoom. Declarations of interest. Is there any declarations for this evening? Seeing none, we will go to our communications section. We have received 5 communications items that have been received and are on file with the board health secretary. And we will ask Member Pinel to introduce our motions, please. Or to introduce the motion for the reports, pardon me.
Be it resolved that the reports titled Election of an Interim Chair, Medical Officer of Health Verbal Report, and 2023 Ottawa Board of Health Meeting Schedule be received and considered.
Carried?
Carried.
Thank you. We will now move to the election of our interim chair. So as noted in the report before us, the board is currently without an elected chair. Further, as required under Section 57(2) of the Health Protection and Promotion Act, the positions of chair and vice chair are to be confirmed at the first meeting of the board each calendar year. Accordingly, the board is currently being asked to appoint an interim chair to be confirmed at the first meeting of the Board of Health in 2023. In the event that more than one member is nominated for the position of interim chair, then a vote will be called. So again, I'll call on Member Pinel to introduce the motion.
I move that Member Kitts be nominated for the position of interim chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2023, pursuant to Section 57, subsection 2 of the Health Protection and Promotion Act.
Member Kitts, do you accept the nomination?
I do.
Excellent. So we will now call for any additional nominations. And we'll do a second call for additional nominations. And a third and final call for additional nominations. Excellent. We will close the call for nominations. There are no additional nominations. So Member Pennell, can you please read the motion to close the nominations for the position of interim chair and the motion to appoint the interim chair?
I move that the nominations for the position of interim chair be closed.
And can we carry this motion?
Carried.
Thank you. Member Pennell?
I move that the Board of Health appoint Member Kitts as interim chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2019?
2020.
I know it was written to, I'm sorry, that's why I thought, whoops, sorry, in 2023, pursuant to section 57, subsection 2 of the Health Protection and Promotion Act. Thank you.
And can we carry that motion, please?
Carried.
So congratulations to Member Kitts, and I invite you to take over as chair.
Thank you so much. I'm having some connectivity issues, some very well-timed connectivity issues, but thank you to Vice Chair DiGiuliani for sharing the chairing duties with me this evening. And I'm very excited to be joining this incredible team and looking forward to working with all of you on these very important files. So moving right along, we will proceed to our next item, which is the Medical Officer of Health verbal report. So over to you, Dr. Etches.
Well, thank you. Thank you, everyone. Good afternoon. Unasukut, Tanche, Ani, and bonjour. I would like to also start by welcoming our new council members to the Board of Health. Online as well. Welcome. J'aimerais souhaiter la bienvenue aux nouveaux membres du Conseil de Santé. I really appreciate your willingness to serve on the board and to lead us through the next 4 years as we'll work together to make Ottawa's people and places healthy and thriving. The community expectations are high for how we continue to adapt and support people to prevent respiratory illness for sure, and to address the other impacts of the pandemic. And we really respect, I speak for all of Ottawa Public Health's team, your expertise that you bring as representatives of the people that we serve. So we look forward to your input on our next strategic plan, on our budget, and on our programs and services. I will start with an update on COVID-19 and other respiratory illnesses, for we continue to put effort into keeping the people of Ottawa informed about the burden of respiratory illness in our community and what can be done to reduce the harms. Santé publique Ottawa continue de s'efforcer de tenir la population d'Ottawa informée du fardeau des maladies respiratoires et de ce qui peut être fait pour réduire les méfaits. So in addition to the dashboard on COVID-19 that we publish now twice weekly, we have been releasing weekly graphics and information on the key COVID-19 data and messages that would be guidance around what this data actually means and give people information about the layers of protection they can use to reduce their risk. These weekly snapshots are shared through Facebook, Twitter, and Instagram channels, and they're posted on our main COVID-19 webpage. I think recently, you'd be interested, and it's important for everyone to understand that we've changed the snapshots to include information about RSV, respiratory syncytial virus, and influenza. So we title our weekly snapshots now as respiratory virus snapshots. They are still being shared through our social media platforms and posted on our main COVID-19 page. So in addition to these weekly respiratory and enteric surveillance reports, we have revised those reports, and they're now featured that you can get to them through our snapshot and at ottawapublichealth.ca flu report. So today, what the data is telling us is that our latest wastewater information is saying that wastewater virus detection levels of COVID-19 are high, and they're similar to last week. Influenza is very high. It's decreasing since last week. And RSV is high and decreasing since last week. We're continuing to see a large number of COVID outbreaks, as well as influenza and RSV in local settings. And we are also beginning to see an increase here in Ottawa of secondary bacterial infections, such as invasive streptococcal pneumonia, which these numbers that we're seeing are really resembling the pre-pandemic numbers, so back to 2019, but different from when we had less respiratory illness in 2021 and 2020. And we're continuing to monitor for other bacterial infections like invasive group A strep, but locally we have not yet seen the increase among children that's been noted in other jurisdictions. So all of this points to the fact that the levels of respiratory illness circulating in our community are high. And so with this in mind, particularly given the upcoming holiday season, we continue to urge people to use every layer of protection. And I'll come back to some holiday messaging at the end. Local hospitals, I think it's important context also to recognize they continue to experience various pressures on emergency departments, on other areas like critical care and in general medicine. And our hospital partners are continuing to share information about how they're managing these challenges during this respiratory season. It's requiring them to pivot to meet the demands of our community. And so our role as Ottawa Public Health is to continue to use our various programs and share information to help keep children and youth out of hospital, to help share the messaging on CHEO's website about where to turn when you need help. And we do continue to do these child-focused interventions really to aim to decrease the pressure on CHEO and the overall health system. One other area of work with children is, of course, on the childhood immunization deficit that we saw in the doses that are still needing to be given, that are overdue. Ottawa Public Health is continuing to work with local partners to offer routine childhood vaccinations. This is really for the growing number of residents that don't have a primary care provider. And this is new work we're expanding into support in those situations. Santé publique Ottawa continue de travailler avec des partenaires locaux pour offrir des vaccins de routine aux enfants, en particulier au nombre plus élevé de résidents qui n'ont pas accès à des fournisseurs de soins primaires. And so we're offering catch-up clinics for students who are in grades 7 to 12 who missed their hepatitis B, meningococcal, and human papillomavirus immunizations. And this was in school normally, but affected by the pandemic. And the school-based catch-up clinics are also for students who are behind on those routine tetanus, diphtheria, and pertussis boosters. So we are now starting to send out notices to parents. We're focusing our efforts this year on getting children caught up in their missed vaccines. And so the letters are going to those age groups and students born in 2005 and 2015, where the records show that an immunization is missing or where there's incorrect vaccination information on file. So the letters are sharing information with parents about how to update their students' immunization record with Ottawa Public Health. We're encouraging parents, all parents really, to check their immunization record for their children and ensure that they are up to date. And parents and guardians can update this information online or with an app, the CAN Immunization app, and more information is available on our Parenting in Ottawa website. So just turning to a subject of interest to new councillors on our board, the budget update. Just to say briefly that last week, City Council approved the budget directions, asking each city department, including Ottawa Public Health, to prepare their 2023 budgets based on a citywide tax increase of between 2 to 2.5% and an assessment growth estimate of 2.2%. Cela présente certains défis. So there are some challenges, but although we're still experiencing increased demands on our workforce and the need to advance digital solutions, certain pressures, we are working towards tabling a draft budget within these guidelines. Certainly, we're also, thankful for the support of the provincial government when it comes to the extraordinary funding that covers the costs of our COVID-19 response. As we come to the end of 2022, we are expecting to spend less on COVID than we had forecasted. So that forecast came out of our Q2 results. And we are expecting that our base budget is on target to balance the revenues and the expenditures by year end. So when it comes to 2023, we are looking ahead to table our budget on January 30th. And it's anticipated that the board then would approve that budget after some time to consider it and consult with the community on February 27th, which would go to City Council on March 1st. And we will be also, to help you consider all of these things, planning a full day orientation session for Board of Health members in late winter, early spring, soon after Council approves the appointment of new public members to the board. So we know there's some more information to come there. And then we will have a Board of Health strategic planning session so we can get your input on our priorities for the next 4 years. And finally, our Board of Health, I know those who are here continuing will remember we've declared racism as a public health issue in June 2020. And given our ongoing commitment to reconciliation, we are planning Indigenous cultural safety training and anti-racism training for board members early in the new year. And that will also extend out to a guided tour of partner agencies and organizations that serve First Nations, Inuit, and Métis community members in Ottawa. So just to return to the holiday messaging, I do encourage everyone to assess their own risk for severe respiratory illness and the risk for those around them, and to make informed decisions. En cette période de fête de fin d'année, j'encourage chacun à continuer d'évaluer son propre niveau de risque et celui de son entourage et à prendre des décisions éclairées. It's not easy to hear this, but we expect things will get worse after the holidays. And we can all do something about it. I want to speak to parents, because we know older adults are bearing the brunt of the worst outcomes. We're still seeing deaths from COVID. And when we work with our children to help them be vaccinated, to wear masks when we're vaccinated, we do make a difference for people who are at greatest risk. And of course, it helps our healthcare system through this respiratory season. On peut prévoir une situation pire après les fêtes. Il en vient à nous de faire quelque chose pour diminuer la pression sur notre système de santé. So, en ce moment, porter un masque dans les centres d'achat, les magasins, les lieux de spectacle et les aéroports peuvent faire toute la différence. Right now, over these next few days, wearing a mask in malls that are busy and crowded, grocery stores that are full, at holiday concerts, and in airports where I hear the lineups are long. It can make a difference when you wear the mask in these situations. And we know we want to gather with friends and family, and we want everyone to be as healthy as possible, to keep our hospitals functioning, to care for families if and when we do need it. So this may mean making hard decisions if someone in your household is sick. If you are sick, please stay home and do not gather with other people. Vaccination is the most effective way to protect ourselves and our loved ones from the most serious effects of respiratory illness. And so I do encourage everyone still, it's not too late to get your COVID booster. It's a bivalent vaccine against Omicron variants that are circulating, and to get their flu shot if you haven't already. They're available at your local pharmacy, some of your healthcare providers, and if Ottawa Public Health continues to offer clinics to children 5 years of age and under and their families. So please know you don't need to have an OHIP card. We'll support you. The other layers of protection you've heard me speak about are to wear a mask when in indoor settings, to stay home if you're experiencing symptoms, frequently wash your hands and use hand sanitizer, and regularly clean commonly touched surfaces like door handles and handrails. If you're hosting a gathering indoors, consider opening the windows, especially while people may be eating or drinking. And I want also to recognize that this holiday time every year we know is not easy for everyone. There are people who are missing at the table, and people are still, recovering from really challenging situations. So I want to also mention that there are resources to link people to assistance with mental health on our website. It's ottawapublichealth.ca/mental health resources. And you'll find services that are available 24/7 that you can link people to, and other ideas and information about how to help people through this time. So, j'aimerais terminer en vous souhaitant de joyeuses fêtes et tout en santé. So happy and healthy holidays to all. This does conclude my verbal report, and I'd be happy to take any questions.
Thank you, Dr. Etches. I think we have one delegation that we'll go to before questions from board members. I believe Mr. McDougall will be joining us via the phone, but we do have a presentation submitted that was submitted in advance that we will get up on the screen. Wonderful. There
Hello.
it is.
Are you waiting for me?
Yes, we can hear you. You've got 5 minutes. Thank you.
Okay, thank you. And just as I start, if it becomes difficult to hear me at any point, please pipe up and let me know. Thanks. So thank you for the opportunity. So I do have the PowerPoint, which makes it easy to reference what I'm saying. The 3 points I want to talk about, I think, are all important. So we'll move to the second slide, about the hospital crisis. And this is, these are just some things that I think, personally, I think there's a low level of awareness of the seriousness of the situation. I'm not even sure how many board members would know about these 3 things. I think one thing I think of when I think of the one on the far right about the what the staff are experiencing in hospitals, it's just getting worse and worse. And the stress, I think of people going every day to work, and it's like that. The conditions are worsening as some people leave. There's no respite. And I think a lot of staff think they aren't being heard. So there is starting a movement. You can see the picture of the protest. I think also just to wonder about what can public health do with the situation in terms of the hospitals being overwhelmed, the healthcare system being overwhelmed, and COVID getting worse. Like there's a real risk that the people's immune systems are becoming less reliable because they've had infections. More and more people are developing long COVID, which is seriously disabling. So it's kind of like a slow moving crisis. It's getting worse, and we can see that it's getting worse, and hopefully we can do something about that. The next slide, please. So this is after the last meeting, where these are a few reports in the month afterwards, and I want to highlight there were 2 reports where Ottawa Public Health Dr. Etches were saying that they would support local businesses and organizations that bring mask mandates, despite Ottawa Health not doing it themselves. And then also looking to delegate mask mandates to the province. So then we go to the next slide. Sorry, just before we go on, if you see in the top right, at the end of the segment, it says Toronto's Medical Officer of Health has been directed by that city's Board of Health to urgently explore reinstating mask mandates. So that was the day after the Ottawa Public Health meeting. The Toronto Board of Health said mask mandates are important, whereas Ottawa Public Health took a different direction, the board members. So the next slide is what Dr. Etches sent to the school board when they were considering doing a mask mandate. And this second sentence there, the science table recommendation, was what at least two of the trustees pointed to as the reason they voted against the mask mandate. So if we go to the next slide, I have the questions where what does it mean when Ottawa Public Health is publicly stating they will support mask mandates and organizations in the community, but then they go to an organization and say mask mandates are not recommended. And then there's like what happened with all the people disrupting that meeting, and it ended in a tie and they don't have a mask mandate now. So, I mean, I think that needs to be addressed. The other questions, I think, if you're saying that it's only up to the province, is there any science saying that a city level mandate doesn't work? And also, are you assessing how well the recommendations are doing at voluntary masking? So then to the next slide, the motion that was passed at the last Board of Health meeting was asking the province to do better public education. So I thought this was something I could let you know about, is that I've started in the last month this crowdsourced database. And I think it's a tool that it has a lot of potential. And it summarizes what it is there in the slide. If you go to the next page, next slide, so it's got on the right-hand side, it says the 4 different sections. So this is a way that people can contribute the information they know what's going on, and other people can find out what's going on. And I think it could be a powerful tool, so I wanted to let you know about it. I think a lot of people, like I said, don't have that much awareness about what's going on. So I think if you have this collection of information that people can access in different ways, it could do a lot. And that's why I'm presenting it. And if you go to the last slide, it's just an example of one of those 4 tables and the kind of contents that's there. So I leave this to you to use as you wish. I think it depends on how people use it, how effective it is. So thank you. Happy holidays and solstice. And I know it's 5 minutes, but I just want to say that I know the board is recruiting. So I hope you can promote that well to see, so people know what's going on. Like, people can contribute, because I think civic literacy is a big thing too. And so hopefully that is an opportunity to promote more civic literacy and engagement. So thank you.
Thank you, Mr. McDougall. We're right on time. Do we have any questions from board members? Seeing none, did you want to offer a comment, Dr. Etches?
Thank you, Mr. McDougall. Maybe just to clarify that we do feel as Ottawa Public Health that organizations are in the best position to assess the risks in their environments and what will work best to increase mask use. And so Ottawa Public Health would have supported the Ottawa Carleton District School Board if they had decided to implement a mask mandate. And I think you were asking also about whether, this is a decision of mask mandates that would be local or provincial. And our experience through the pandemic is that the virus doesn't stay within a city. People don't stay within a city. It really is a province-wide challenge right now. And so to be able to decrease the waves that are coming through our province, it really requires that provincial-wide action. Now, that said, if more people wear masks in Ottawa, that's better for people in Ottawa. And so that is why we continue to highlight wearing masks is safe, and wearing masks does decrease transmission of respiratory illness. And so we do recommend it. I think a strong recommendation has not got us to the majority of people in all situations wearing masks that we see. We do see that there has been some increase in masks, and as people understand the situation is getting worse. So we're going to continue to inform people and make it as easy as possible for people to wear masks. But we know also that people are in a different situation right now. We're not trying to stop all transmission of viruses. We're recognizing the protection people have from vaccination, and we want people to wear masks now to help the hospitals manage through a peak of the respiratory season. So the way mask use is being promoted is as a temporary measure that will get us through the worst. It's not, in the same category as earlier in the pandemic. But I do want to be clear, it makes a difference. I continue to say that, and I think that appreciate people today, and when we see people wearing masks, it's a sign of caring for others that we continue to need through this period. So thank you.
Thank you, Dr. Etches. We'll move now to questions from board members. So for new board members, just so you know how this is going to work, I'm going to go through the list in alphabetical order so that everyone has an opportunity for questions, or you may choose not to ask any. So Member Banham has had to leave, so we will go to Member Carr. No questions? Okay, no problem. Next, Vice Chair DiGiovanni.
No questions for me.
Member Dudas.
No questions for me.
Member Gower.
I have one question that I haven't asked in a while. Dr. Etches, how is the Ottawa Public Health staff doing?
I'm sure they appreciate the question, Member Gower. I would say we have some data that suggests things are getting better when it comes to people taking vacation. The trend is better than previous years. When it comes to overtime, the trend is better, decreasing use of overtime. When it comes to sick leave, we've seen throughout 2022 more sick leave still. So we would like to see that turn around. We know there's more virus in our community, which is causing challenge too for many health organizations. The employee pulse we just did is an important, more fulsome assessment of what's happening for people in Ottawa Public Health as employees. So their workload, their supervisors, time with them, one-on-one meetings with supervisors, support. It really also explores or questions in this employee pulse about how people are managing balance between work and home, and if they're concerned about their mental health. So we just did this pulse in November, and we've been providing the results back to the whole organization. And I think, again, we have seen some improvement in, workload for some over from the last time we did the pulse, but I'm not happy with everything I'm seeing in terms of there still is definitely a problem with workload. And that's why I mentioned in talking about the budget, we can only do so much work with the people that are part of our team. We need to work hard to scope our work to fit rather than asking our people to work, beyond what is reasonable. So this is one of the pressured areas we're still looking at to try to right size their work and their resources. And I think, in terms of, welcome anyone else from Ottawa Public Health who wants to speak about how we're doing. That's anyone who wants to add. I think one thing we are seeing is we're seeing some excitement about the next strategy. So we have been working to look at what do we need to focus on in the next 4 years, and I think that's brought some excitement. And the team right now is just starting to look at what we'll bring to you around our mission, our vision, our commitments, and the really priority areas of focus for the next 4 years. And I think we'll get more feedback from the whole team and bring that to you. So
Thank you. And I think it's something as a board we need to keep checking in on as we go. Related to that, I guess, you mentioned that post holidays could be a very busy time. Do you anticipate having to ramp up staffing or operations or extended vaccination clinics like we might have seen earlier in the pandemic at this point?
I might ask Andrew Hendricks to speak to how their team is managing outbreaks, because that's one of the pressured areas when infections go up in the community. For vaccination, we're in a more stable position. The demand for COVID and influenza, even we're just starting to fit in those childhood vaccines. The demand is fairly predictable now. So we don't expect having to do another round of vaccination. Andrew, is there anything you wanted to add about surge?
Yeah, sure. Thanks, Vera. Thanks for the question. So what I would add is, I mean, we do have staff that work over the holidays. We always have to maintain a certain minimum staffing level to manage things like outbreaks, infectious diseases. Even over the holiday period, we have people who are on call, those types of things. So we make sure that during the holiday period, we have staff who can advance those priority outbreaks, supporting those institutions. And then, then early in January, when people come back, they're hopefully well rested and rejuvenated. But we do have adequate staffing levels to manage those outbreaks and those high priority areas and institutions when needed. So.
Okay, thank you very much. And thanks as always for all of the good work you do in our community. Thanks, Chair.
Thank you, Member Gower. Great questions. Next, Member Kavanagh.
Oh, I didn't think I was a member tonight because I missed the swearing in. No questions. Thanks.
Thank you. Member King.
No questions, but just thank you for the very in-depth report and for the work that public health is undertaking, especially during this difficult time.
Thank you, Member King. Member Lycan.
Thanks, Chair. I did have one question, if I could, about flu shot uptake. Given the extraordinary events that are occurring at CHEO and our other hospital partners, does OPH have data or access to data that lets us know how the community's uptake on flu shot has been this year? Generally, how the community is doing in that regard?
So we've really had the best system for counting immunizations when it comes to COVID, and there isn't such a system for influenza. However, the ministry does work to put together data as the flu season goes on in terms of the vaccinations that have been given. They have the pharmacy-based data, some primary care-based data. We give the minority of flu shots in Ottawa, and so we have less information about the whole population. But I would invite Marie-Claude Turcotte to speak to what we do know about uptake of flu vaccine.
So I do have some preliminary data in terms of what has been given as flu vaccines in Ottawa. The data I have is pharmacies as of December 14th had given 247,000 vaccines. And we've distributed a little over 200,000 to primary care. So that's not the number that we're actually given, that's the number that we've distributed. We will get more information around primary care, how many they used in their office at the end of the season. And we've given in our clinics around 11,000 vaccines. Those numbers are comparable to other years in terms of overall uptake. What we're missing, as Dr. Etch has mentioned, is breakdown in terms of ages and who's actually coming to get those vaccines. We unfortunately don't have as good of a system for influenza as we do for COVID.
Thanks very much. I guess the impetus behind the question is whether we have a sense of, on a proportionate basis, if our uptake year to year has changed and if there's opportunity to try to grow that as we think about going forward. But thank you.
Sure. if I may comment once more on that, there is no question that more people could benefit from an influenza vaccine than have come forward to get it, especially younger age groups. We know while this proportion of our population may end up to be similar to previous pre-pandemic years of vaccination, it is often the coverage of flu vaccine is lower among children. And we don't want that right now. When we see so many children ending up in CHEO for flu, we'd really like to see more children with the flu vaccine. It's an important protection. It does make a difference. So we'll be able to report back as soon as we get the data. But at this point, I think it is fair to say that there's room for more influenza vaccine to be given.
Thank you very much.
Thank you, Member Lakin. Membre Pinel.
No questions, thank you.
Merci. Member Tilley.
No questions, thank you.
Okay, great. Thank you, everyone. Can we receive the verbal report? Thank you. Item 7.3, 2023 Ottawa Board of Health meeting schedule. Does anyone have any questions? Seeing none, can we carry the meeting schedule?
Carry.
Great. We have no in-camera items. Motion to adopt reports. Membre Pinel, s'il vous plaît.
Il est résolu que les rapports intitulés « Élection de présidente par intérim », rapport verbal de la médecin-chef en santé publique et horaire des réunions du Conseil de santé d'Ottawa pour l'année 2023 soient reçus et adoptés.
Carried. Thank you. I have no motions requiring suspension of the rules, no notices of motion. Confirmation bylaw, Membre Pinel, s'il vous plaît.
Be it resolved that confirmation bylaw number 2022-7, a bylaw of the Board of Health of the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of December 20th, 2022, be read and passed.
Carried. Merci, Membre Pinel. Any inquiries? Seeing none, we will move to adjournment. The next meeting will be Monday, January 30th in the new year, 2023. I'd just like to wish everybody a very happy holiday season, happy and healthy. Notre meilleur vœu pour le temps des fêtes et en toute santé. Merci. Thanks, everyone.